Greetings, my name is Luis Fernando Toffoli. I am professor at the University of Campinas. And I'm here to present to you some evidence about the social impact, a possible social impact of relaxing marijuana laws in a very brief presentation. The issue is complex, as we're going to see, and I do not intend to exhaust all the possibilities about this question, but to give you some information that might be useful when we are discussing marijuana and the changing of marijuana laws in the world. First of all, let's explain what we mean by relaxing marijuana laws. Basically, we're going to talk about decriminalization or depenalization of use, and it's important to keep in mind that we have many different options regarding this question. We have, for instance, the de facto marijuana legalization in Holland, in the Netherlands, which is not a legalization, but it's a type of decriminalization, a particular type of decriminalization. We have, for instance, the example of Portugal or the example of Australia, and many countries have decriminalized or depenalized drug use in general, or marijuana, and specifically we also have in the United States differences from state to state. So it's important to keep in mind that even when we are using one of these expressions, we are meaning many different approaches. And this is the same for the medical marijuana laws, and basically here I'm referring to the states. Silvia Martins has mentioned and given more details about this, and also highlighted how many differences are between different states. And so, for instance, we have the example of California that had its medical marijuana law. It's from 1996, and it's a very, very flexible approach and tolerant. And for instance, we have Utah, which has only legalized the use of cannabidiol CBD. So it's states that have no type of marijuana law. So we have a great heterogeneity in the states. And also, when we're talking about legalization, here we can only talk about Uruguay and some American states. And also, when you compare Colorado to Uruguay, we have different approaches. And it seems that new initiatives in the United States will also bring different approaches to marijuana legalization. So we have to keep in mind these differences all the time. By social impact, I'm including and I'm talking in a very broad sense about this. I'm not going to talk about health impact or psychiatric impact. I'm going to talk about basically influences in other issues. For instance, prevalence of use, I'm including this in social impact. Youth use, accidents due to marijuana or influenced by changes in laws, in marijuana laws. Drug price, which has been shown by economists that is associated with when we have a lower price, we have a higher rates of use. The issue of violence and other issues that I'm going to present to you in a very brief manner. As to issues of this research, I tried to focus on the more recent literature whenever possible. The empirical evidence is mostly from ecological studies, but we have some other studies, some epidemiological studies as well. And when we are talking about legalization, we don't really have data from scientific sources that could say that we have evidence. So basically, mostly when we're talking about legalization, we're talking about predictions based on changes in decriminalization or medical marijuana laws. This data came from basically from the economics, from public health, and from psychiatry. So we are talking about interdisciplinary data, and it's difficult to make systematic searches such as we are used to do in the public health and the medicine field, health fields. So in a sense, we cannot talk about a systematic review. This is basically a narrative review of recent results about these questions. First, let's talk about decriminalization. I'm going to show you some evidence from different countries. I'm going to start from this evidence from Australia, from Brettville and Williams. And they have shown in Australia the effect of decriminalization in some states has shifted youth use to younger age, but hasn't increased use rates of marijuana. When I'm talking about use rates, I'm always talking about marijuana only when otherwise I'm going to state it. So they also showed that the process of decriminalization had shown a great impact on youth, again, but no evidence for a long-run effect, with an impact that would be restricted to the first 5 years. In the US, we have evidence about a greater chance of pediatric exposure in states with decriminalized marijuana. And these are the undesired effects. Model has shown about a shift that could happen from more harmful drugs to marijuana in some models of cannabis decriminalization. In the USA as well, there's no evidence that states that have decriminalized have had a significantly impact in drug use in terms of prevalence. And when we compare the models of USA, Switzerland, and Australia, we have no systematic relation with higher rates of cannabis or illicit drug use. We also, considering the particular model of Holland, which I have decided to put inside the context of decriminalization, but in fact it is somewhere in between decriminalization and legalization. A lot of people mention it as de facto legalization. There is apparently no increase in use rates, and there is an apparent separation between cannabis use and harder drugs and more harmful drugs, which is what it was intended from the policy from the start. We also have recent data from the Czech Republic where there was no evidence of decrease in age of onset of marijuana use with when decriminalization happened there. There's also an issue that this is only a question. We have to question ourselves about the healthcare access, because decriminalization is, it seems to be very important for offering users of hard drugs access to the health system. And this does not seem to be a very severe question for cannabis users. So this is probably not as important. It might be a marginal effect, but not as important as we're going to, this is discussed in terms of harm reduction for more harmful illicit drugs. Also, considering the decriminalization of all drugs, and the most famous case is Portugal, the research that was made found no decrease in the price of illicit drugs. Also, HIV care improved in Portugal, and there is no substantial difference in the rate of drug use. It has floated, going up and down, but it doesn't seem to reflect the change of status of legalization or of criminalization or not. And there is a possible reduction of youth use, which seems a little bit paradoxical. And also, Vuolo has worked on European data and have found no association with increased rates of any drug use in in countries which have presented decriminalization or some sort of depenalization or flexible changes in their criminal approach to marijuana or drugs in general. This can be translated in this graphic from the annual 2011 annual report from the European Monitoring Center for Drugs and Drug Addiction, which shows basically that the change from decreasing penalties or increasing penalties do not seem to change trends that happened before. So in terms of drug use, and this is specifically data for marijuana, there seems to be no clear effect on terms of status of decriminalization or non-decriminalization. So this is also important. And this is the data from South America. We have 3 countries which have decriminalized drug use: Argentina, Colombia, and Chile. I apologize for the slide in Portuguese. And also, and this examines the number of deaths in motor car vehicles accidents for 100,000 inhabitants, and also again the fact of decriminalizing drug use. All drugs do not seem to affect the occurrence of this, the incidence of these events. So one important thing to think about decriminalization, I'm sorry, this is not about medical marijuana laws, but decriminalization. One important thing is, what does it mean to decriminalize? So when we examine the different countries, what we find is a very different approach. So it's difficult to think about decriminalization as a singular policy. There is a tremendous variation in laws and regulations that surround this change. So one important issue for research is to be careful when conducting comparisons and ecological studies of decriminalization policies. And I'll come again to this later. Sorry. Regarding medical marijuana laws, the evidence that we find, I'm talking basically about recent evidence. We have the effects that could be found were a decrease in price and an increase in potency when compared, and here we are basically talking about American states, comparing one state with other states or states with medical marijuana laws with others which don't have these laws. Undesired effects, you're going to find an increase in fatal motor vehicle crashes with positive tests for marijuana, and also the increased risk of accidental pediatric exposure to marijuana from children eating the medicine of people who have it in their homes. Also, it seems to have an increase in marijuana initiation, but also we have, this has been presented by Silvia Martins before, no changes in rates of youth use, and this is an important study because it's an epidemiological study on the individual level. Though we do find higher rates of marijuana in medical marijuana law states, and it's not clear whether this has any causal effect, or if we are talking about states which are more permissive to the idea of marijuana in general. So this would possibly reflect on prevalence or rates of prevalence use. Also, we find higher rates of marijuana use and problem users in states with medical marijuana laws, but no higher proportion of problem users among all users. And then in another study, we find increased rates of use and problem use. So as Silvia mentioned, we don't have a clear picture when you're talking about this. We have contradictory results. For instance, we have some studies that have shown no effect on youth use, no effect on rates of use in general, no detrimental effect on safety, so we don't find more crime in states with medical marijuana laws, and also reduction of traffic fatalities, and which has been hypothesized that could be associated with migration from alcohol use to marijuana use, and this would be have a lesser impact on motor vehicle crashes. About desired effects of these policies, we would find lower opioid overdose mortality rates, decrease in alcohol consumption, and no impact on other drug consumption in terms of higher prevalences. But then, again, we have the details, and Pacula reminds us again about this. First, we have to keep in mind that medical marijuana laws are very different from state to state. And depending on the regulation model, it's possible to find higher rates of marijuana use or alcohol drinking. And so we have shown that this would have no impact or have a decrease in alcohol drinking. But this depends on which type of regulation and how permissive these models are, how more restrictive are the policies about how to get access to marijuana. So this is something very important if we keep in mind that the world might change marijuana laws globally in a very short period of time. So if this is going to happen, it's very important to provide the right information about how this would happen with less harmful effects. And then we have the issue of legalization. And here, basically, what we're going to see is a discussion about the need to, first of all, international conventions, international law conventions would theoretically not allow changes in terms of legalization. So this would have to be changed and discussed to allow this to happen in a more in an environment that would have lesser law issues regarding that. Also, there is a study that's interesting that showed that normally people who have used marijuana in their lives before tend to support legalization. So this is also an issue for the difference of prevalence from country to country. This might explain why some countries are more flexible compared to others. And some other effects have to be kept in mind. For instance, in Colorado, there have been some problems about emergency room entries, especially people having intoxication with edibles, people who have never tried marijuana and are going to try for the first time using edibles, and this is probably not a very good idea. Also some problems from THC extraction for dabs using butane. So there are some undesired effects that have been already found in Colorado that we have to keep in mind when thinking about marijuana legislation and relaxation in the future. So when you're talking about legalizing, we are talking about predictions, and these predictions also vary. Based on California, Kilmer predicts that legalization with legalization we would find lower prices, increased consumption, and there are doubts about how to calculate the impact of public budgets, because there are some doubts about how tax revenues would reflect that, because lower price would theoretically imply in higher use, and this would have to be controlled with taxes. But this tax cannot be so high that people would go to the black market. So there are some just fine-tuning about this question that are not completely answered, and from the cases that we have already on course. Also, Calkins predicts a dramatic reduction on wholesale prices, effects on consumption, basically getting higher rates of consumption, and also revenues, tax revenues, but depending on design choices. So how much is the tax level, how lenient this model is going to be to the black market, how is going to be the control of cannabinoid levels, decisions about home cultivation and advertising and warnings and etc. Anderson and Rees suggest that the legalizing marijuana will imply a reduction of alcohol harms, increased youth use, a stable overall consumption, and, in general, positive public health benefits, including considering that incarceration for marijuana laws are a problem, and they are also public health problems. And Palomar predicts that from interviews from high school seniors that the prevalent rates are expected to increase with legalization. So, also, again, we have to talk about which legalization, after all, we're talking. For instance, Rem and Fisher suggest that the best marijuana policy in terms of legalization, and actually they say about any kind of marijuana policy, the best option would be legalization with a strict regulation. On the other part, Getman and Kennedy think that the public interests would be better served by a regulatory framework, recognizing and taking advantage of the free market. So we have very different, and if we see the differences between Colorado and Uruguay, for instance, they show that there is no one marijuana legalizations, but we have the possibility for plenty of them. And I'm not going into every one of these issues, but these are also questions that have to be addressed when we are talking about legalization. So how it's going to be controlled for edibles. The question of advertising and warnings is very important. Control of pesticides for marijuana agriculture, which are going to be the pharmaceutical standards, and if there is really alcohol substitution, if alcohol is substituted by marijuana. And I haven't mentioned, but Camila has mentioned that, and Sylvia as well, that the current model has a lot of problems as well. We have ethical problems with it. We have human rights problems. We have health problems that are associated with this model that seems to bring problems without solving most of the problems that we have. So you have to choose among these different options, considering that this moment, the option that we have at the moment in the world is probably not good as well. But Maurice is going to talk more about it, so I'm not going into it at the moment. In summary, general results are mixed and difficult to interpret. But it's probable that an increase in marijuana is to be expected if we relax marijuana laws. The question is if this is necessarily bad or not. Depending on age and depending if there is substitution of alcohol, this might not be so bad, and it might have virtuous effects on public health. And for understanding this question, we have to examine the models of reforming these laws and their differences. It's putting them all together, as most of the studies do, will probably not give us a very clear picture of what is happening. So we need more studies about this, which is obvious. And I think one of the most important questions, among the most important questions, is how to prevent youth use and how to prevent drug under influence of cannabis. And if we have how to address a scenario of a slight increase in adult use. Is this good? Is this bad? I think only the future will show this. And these are the references I use in this presentation. Thank thank you for your attention.